ladies, I'm Barbara and I am your menopause drama mama, and if you are new to my channel, I welcome you. Today is a very important subject, and it's all about breast cancer and the fear women have of it once they, start perimenopause through postmenopause years. And I know there was a huge fear instilled in women about the HRT that I will cover a little bit in this video, but there are some major factor causes that put women in a higher risk for breast cancer after your menopause years. And the first risk factor is obesity after menopause. And this is these are some of the reasons why, but the fat tissue produces estrogen after menopause. Excess body fat increases your estrogen levels, your insulin levels, and the inflammation in your body. So higher body fat has been linked to increased breast cancer risks in many studies. Maintaining a healthy weight helps reduce that risk factor of breast cancer after menopause if you are not obese. Now, the second risk factor is alcohol consumption. Alcohol is one of the most consistently identified lifestyle risk factors for women, and the risk appears to increase as alcohol intake increases. So alcohol raises your estrogen levels, it increases oxidative stress, and most importantly, it affects the DNA repair mechanisms. So we all carry like some type of cancer cells in our body, but our body knows how to destroy them. But when you drink excessive alcohol, it changes the DNA in your cells, so then they cannot go in and repair those cancer cells. So it will increase your breast cancer risks the older you get if you drink, alcohol in excess. So even moderate alcohol intake can contribute to your breast cancer risk also. So I would just, be more aware of if you are drinking alcohol, that the older you get, it could very well enhance that risk for breast cancer. Number 3 is lack of exercise, because physical lower activity raises the inflammation in your body. It also raises the insulin sensitivity in your body if you are not exercising, and it will not be able to help with that hormonal balance for you. So women who do exercise regularly generally have lower breast cancer risks than sedentary women. So if you are a couch potato, I would suggest that sometime during your day, you try and just cut out maybe 15 or 20 minutes just to get in either a walk or do some resistance training or do some weights for your arms, because it will be very beneficial for you and help reduce that risk of breast cancer. Risk factor number 4 is lifetime hormone exposure. This is very important for a woman because breast cancer studies have shown. So the earlier you start your period in your life, and the longer you have it throughout your lifetime. So if you go into menopause later in life and you started your period earlier, there's a long span that you had your period during your lifetime, and that is one of the causes for breast cancer. And women who have never had children, this can create a higher risk also for you for breast cancer. And Women who have never breastfed their children can increase cancer risks. And also having a first pregnancy later in life can increase your breast cancer risks. So, they say the more children you have, the lesser risk you have of breast cancer, because then, like for me, I had 3 children, so there was 27 months out of my life that I did not have a period, so that can put me in a reduced risk factor. I am not one who drinks alcohol at all. I just don't like the way it makes me feel, because a lot of times it will trigger a migraine, and for me, alcohol is not worth the pain I go through to have, migraines that will keep me down for days on end. So, I've always really stayed away from that. So that, is beneficial for me, thank goodness. Another one is the family history and genetics, and that is risk factor number 5. So if you have the BRCA1 or BRCA2 mutations, that can significantly increase your chance for breast cancer. But most women who are diagnosed with breast cancer do not carry these mutations at all. And most women diagnosed do not have a strong family history. So it is more about, things that you are doing, that is why you would have breast cancer. So genetics do matter, but it's not the leading cause for breast cancer in women. Now, the HRT controversy, and this goes back to the 2002 study for the WHI, which was the Women's Health Initiative. And when they did this, more women, a lot of women were on HRT, which is the hormone replacement therapy. And there was a doctor, and I can't remember what his name was. I don't know if it was an Italian name, but I should have written it down. He was a cardiologist, and that's what triggered the WHI study, because he had realized that women were not going to cardiologists as much anymore after they were on hormone replacement therapy. And remember, I've covered this in prior videos, but heart attacks is the leading cause for women to die after menopause when you are not on HRT. So this doctor influenced that study, and then they instilled fear in women, and the study ended up being very flawed. And then women, they bailed on their HRT, and then if you can look, actually there's research studies that show during that time the type of prescriptions that skyrocketed for women who all dropped their HRT, and of course, the heart attacks or heart issues went up, and depression went up, and anxiety went up. So women were prescribed other medications instead of their HRT. Now, in that study, they used a synthetic progestin, which was medroxyprogesterone acetate, which is MPA. And there is a micronized progesterone, but that is what is similar to our bodies, and that is what I take. And it's an oral pill that I take at nighttime. So studies have shown using micronized progesterone actually can reduce a woman's risk of breast cancer. And so they used a synthetic progestin, and that was used in the WHI study, and it does increase the risk for women to get breast cancer. The other thing that they used was, like a bovine urine. And that's what was used for estrogen in that study. So it was not a bioidentical at all for the estrogen. And the bioidentical like patch that I am on, that actually decreases women's chance for breast cancer. So in a simplified, I guess, an overview, is the synthetic progestins or estrogens can increase the risk for breast cancer, but the like micronized progesterones and the estradiol patches or estradiol creams, and I'm not sure if there's another form to take estrogen that's in a linked to being bioidentical to our own hormones. But when you are on a bioidentical, that actually will decrease the risk for breast cancer for women, and there are studies that show that. So the factors that will influence breast cancer is your body weight, your alcohol consumption, physical activity, metabolic health, insulin resistance, and overall lifestyle habits. So breast cancer is extremely complex, and there are several different factors that increase that risk. But there is no studies right now that show that bioidentical hormones increase that risk for women. And you can look that up. There are plenty of doctors who have studies out on that, and there were many studies before the WHI study. So that is it, ladies. Those are the risk factors for women to possibly get breast cancer after menopause. So I hope you enjoyed this video. I hope it was very informative to you. And I really, really hope that if you had that fear of, bioidentical hormones to take, I would find a menopause doctor. I always list them below right here in my box for, click more. There's a description box. And I always list Menopause Society. And there's a little drop down. You can put in your city, your state, your country, and it will list the menopause doctors near you. And I think that would be your best bet if you are looking at wanting to go on HRT or BHRT for bioidentical hormone replacement therapy. So ladies, I hope you're having a fantastic day wherever you are in this world. May the sun be shining upon you. And I will talk to you very, very soon in my next video. Take care, love and hugs. Bye-bye.